There's obviously a lot of people who have atrial fibrillation, may have even felt the symptoms of atrial fibrillation. There's the hidden part where that could be, there's some symptoms that they discount the symptoms and maybe credit them to something else. For instance, people describe atrial fibrillation feeling like you're having a racing heart. But that's also the way it feels when I have 3 cups of coffee before 10:30 in the morning.
True.
So is it that possible that what are those symptoms that you may be looking for that you may, no one wants to believe they have some underlying real condition. Some people want to believe everything is, but most of us, if we have a symptom, we may discount it completely. So what are those symptoms and when should we be concerned about? And then ultimately, what should we do if we're feeling those symptoms?
So this is something that you need to look out for because atrial fibrillation is the most common arrhythmia that people would have. And as you get older, it's more and more common. People over 85, 10% of people over 85 will have atrial fibrillation. And from 65 to 85, it's anywhere from 1 to 7% of people may have it. So it's definitely something you need to look for, but sometimes it's hard to tell. I don't know if some of you can feel your heart beating. I can feel my heart beating sometimes. Just like James said, if I drink some caffeine or something like that, it seems to beat harder or something like that. Or some people, if their blood pressure is higher, they can feel their heart beating. But you can also feel your pulse. Like if you feel your pulse, you can feel it beating regularly. You can feel it on your neck. You can feel it beating regularly, and it just beats regularly like that. If you have atrial fibrillation, you may feel what is called palpitations. Palpitations is basically when it feels like your heart is not beating regularly, when your heart is beating a different way than it normally does. That may be the first symptom, palpitations. You may also feel lightheaded. You may feel a little dizzy. You may feel a little short of breath. And if you're feeling short of breath and dizzy and you feel your pulse and it's very rapid, you could have one of a few different arrhythmias, but atrial fibrillation would actually be the most common one. So that's something to look out for. If you do feel your pulse and it's rapid, but it's irregular, atrial fibrillation is called an irregularly irregular rhythm. That's kind of a mouthful, but what that means is some rhythms are irregular in that they're too fast, like say tachycardia is too fast, but it's regular. It comes at 150 beats a minute, but it stays that 150 beats a minute. AFib can go from 70 beats a minute to 150 beats a minute to 130 to 120, all within 1 minute. So it's very irregular and it's bouncing all over the place. So if you feel your pulse and it's bouncing like that, it definitely is something that you need to have checked out, particularly if you have dizziness or feel short of breath or something like that with it. But again, 20% of people that have a stroke associated with AFib, the first sign of their AFib, they felt nothing before that. The first sign they had was a stroke. So it's not something that everybody can feel, but if you do feel it, it's something that needs to be checked out for sure.
So what you're saying is it can be persistent. Some people have persistent AFib, but it can also not be persistent. It can come and go. And so one of the questions that are already on the screen, it's a great time to maybe ask that question, is Apple and other companies make devices that if I feel that arrhythmia, the time I call and make an appointment, get in to see the doctor, I could be out of that arrhythmia. So what would you look for? Would you order an EKG? And what do you think of these devices that Apple and others make that allow you maybe in real time to test whether or not you're out of rhythm?
Yeah, so my son was having some palpitations when he was in college, and we bought a device that went with his Apple Watch. He didn't have the newest Apple Watch, so he bought a device where he could just put the 2 thumbs on it and he could put those on the little pads and it transmitted to his watch. And he would have symptoms that he thought were related to that, and he would send me an EKG and it would always be normal, but they can pretty accurately show AFib. And I was on an airplane, not too long ago, and somebody was having some heart problems, and it was the old, is there a doctor in the plane? And I was like, here I am. And so I went back there and a guy had an Apple Watch and he stuck it on the person that was having a problem and it showed their heart rhythm. It's pretty accurate. They were not in AFib, but I have definitely seen people in AFib that had an Apple Watch and it definitely showed the AFib. The problem with using using that for screening is a lot of people that have Apple Watches are not in the group that AFib is prevalent. I mean, how many over 85-year-old people do you know that have an Apple Watch? So they do work, but most people that have an Apple Watch are younger. Like, I don't even have one. My son has one. He's 21, and my daughter has one. She's 17. They're not in the group that has AFib. So, they're going to be using it, and there's going to be some false positives because they're not in a high probability group.
I do hear that there are some people at younger age that can go into AFib, and I hear people that do extreme exercise sometimes can exercise themselves into AFib or arrhythmia.
So
is that accurate? Probably not our audience doing a lot of that, but I think
not the people here on this screen. So that is possible. The way you exercise yourself into AFib or another arrhythmia is to get abnormality in your potassium or your sodium or your calcium by being dehydrated and exercising too long without drinking enough water and things like that. So that would be fairly rare. The main risk factors are risk factors like everything else that we probably talk about on this show, and that's diabetes and obesity, hypertension, smoking, heart disease. Those are the main risk factors for AFib. So if you already have hypertension, you already have diabetes, and then you start feeling that palpitation, definitely you can check it on the watch or you can check it on one of the other devices. And if it says AFib, you need to go have a 12-lead EKG done and you need to get it checked out. If you do have AFib, you need a physical exam by a doctor to listen to your heart, they can hear the rhythm on your heart. You need an EKG. You need an echocardiogram to see if there's any structural problem with your heart or with one of the valves that's causing the AFib. You need thyroid tests done because hyperthyroidism is another risk for atrial fibrillation. It's almost like funneling caffeine all the time if you have hyperthyroidism, and it can definitely give you AFib. You also need to be checked for renal and hepatic function, and those are other things that can cause AFib.